Hello dear students, in this video we are going through the National Exit Test NExT. All information regarding the NExT. NExT will be conducted in two steps, NExT step 1 and NExT step 2. So this will be in two steps, NExT step 1 and NExT step 2. Now first we are going through the information regarding the NExT step 1 examinations. It shall be a theoretical examination. It consists of multiple choice type of questions or MCQ questions. It's a computer based online mode of the examinations and it's a centralized examination. That means only the single common all India examinations will be conducted. For example, the NBE that conducted the DNB examinations like that. So it's a theoretical MCQ type computer based online examination and it's a centralized or one centralized body will going to conduct it. The examination shall consist of 6 papers covering the subjects of 3rd MBBS or final MBBS both part 1 and part 2. This includes the medicine and allied disciplines, surgery and allied disciplines, obstetrics and gynecology, pediatrics, otorhinolaryngology, ophthalmology, applied aspects of all subjects covered under 1st MBBS and 2nd MBBS, applied aspect of all subjects covered under 3rd MBBS or final MBBS part 1. So all these subjects are included in 6 papers. The student who have completed the 3rd MBBS or the final MBBS course or the curriculum, that student will be appear or eligible to appear for the NExT step 1 examination. This examination held once a year prior to the university practical examination for 3rd MBBS part 2 or the final MBBS before the internship. So this examination held once a year before the university practical examination for 3rd MBBS or the final MBBS. The student who have failed in the NExT step 1 examination at the first trial will appear for the supplementary examination and that shall held once a year. And this supplementary examination is restricted to only those candidates who have failed in one or more of the 6 papers and are required to repeat those particular papers or subjects. Alright, so the student will have to give the repeat exam of the subject in that they have failed. Not all the subjects, that is what they have said. Who have failed the NExT step 1 regular examination as well as the supplementary examination of a particular year shall be appear for the NExT step 1 regular examination only in the following year, that means the next year. No restriction to the number of attempts to appear, that means you can give NExT step 1 as much as number of time you have capabilities. Candidate has to pass both NExT step 1 and NExT step 2 examination within 10 years of joining the MBBS course. That means once you join the MBBS course, from that date till 10 years you have to complete both NExT step 1 and NExT step 2 examinations. There is no restriction to the number of attempts to appear in the NExT step 1 regular examinations to improve the score. That means one time you gave the NExT step 1 examination but your scores was average and now you again want to give repeat examination to improve your score. So you can give, number of attempts will be available and you can use it. But this repeat test for the improvement of the score are taken at least after 1 year of completion of the NExT step 2. Alright, so this you should keep in mind. NExT step 1 shall replace the conventional university or institutional theory examinations of 3rd MBBS or the final MBBS part 2. That means NExT step 1 examination will replace 3rd final MBBS part 2 theory examinations, not the practical or the clinical examinations. So at the completion of your 3rd part 2 MBBS curriculum, now you have to give NExT step 1 examination as well as practical clinical examinations. And in each paper of 6 paper, minimum 50% is required. That means each 6 paper you require 50% mark to pass the NExT step 1 examination. So the criteria for eligibility for provisional registration to pass in each of the 6 theory papers of the NExT step 1 and pass in 3rd MBBS final MBBS part 2 practical and clinical examinations. If you pass in both, then and only you are eligible for the provisional registration. And once you got the provisional registration, Afterwards, your internship will begin. So for the provisional registration, you have to clear NExT step 1 examination plus practical clinical examination of the third MBBS part 2. Now once you complete your internship, you have to give the NExT step 2 examination. NExT step 2 examination is a practical or clinical and viva voice examinations and cover all 7 clinical subjects or disciplines. This includes medicine and allied disciplines, surgery and allied disciplines, obstetrics and gynecology, pediatrics, otorhinolaryngology or ENT, ophthalmology, orthopedics and PMR. So all these 7 clinical subjects will be included in the NExT step 2 examinations, and this is the clinical practical viva voice type of examination. Now some more detail about the NExT step 2 examination. This shall be objective structured, clinical case based or simulated cases, patient aimed at evaluating the practical or clinical skills, clinical decision making and communication skills expected of an Indian medical graduate. So this is the offline examination. NExT step 1 is the online examination, computer based, but NExT step 2 is the offline examination where you have to face the patient. It's a case based or patient aimed examination held in person, live, and shall be conducted by the respective state health universities or the institutions. Now this is not conducted centralized. The centralized authority have given the permission to conduct the NExT step 2 examination to the state health universities or the institutions. However, the NExT step 1 examination is centralized, conducted by one single body or the authority of the India. There shall be regular NExT step 2 examination once a year. Supplementary examination shall be held once a year and is restricted to only those candidates who have failed in one or more, up to 3 subjects of 7 subjects. That means out of 7, if you failed in 3 subjects, then and only you will appear for the supplementary examination. That is the meaning of this sentence, and are required to repeat the particular subject. That means the subject that you have failed in NExT step 2 examination, that subject only you will going to repeat it, not all other subjects. The student who do not pass both NExT step 2 regular examination plus supplementary examination, that shall be appear for the NExT step 2 regular examination only in the following year, that means next year. There is no restriction to the number of attempts to appear in the NExT step 2 examination. However, the candidate has to pass both NExT step 1 and NExT step 2 examination within 10 years of joining the MBBS course. Now the NExT step 2 examination scoring. NExT step 2 examination results shall be declared as only pass or fail based on the acquisition of appropriate competencies that is being evaluated. Only you will get the result of either pass or fail. Minimum score for passing. The criteria for passing NExT step 2 shall be satisfactory demonstration having the acquired the competencies that are evaluated, that shall be declared as pass or fail result. That means the examiner that going to check your competencies, and depending upon your clinical demonstration, if it is satisfactory, then you will be declared as pass, otherwise you will be declared as fail. Now the eligibility for grant of license to practice. Now here remember this point, you have to clear NExT step 1 examination plus traditional university practical examination of final year MBBS part 2. After clearing both these examination, you go for the internship of 1 year. Once you complete the internship, you have to appear for the NExT step 2 examination. After the NExT step 2 examination, if you are declared as pass, then and only you are eligible for the grant of license to practice. Has completed appropriate duration of internship as applicable, having the fulfilled the requirements that are provided in. Has passed NExT step 2 practical or clinical examinations. And to eligible for the internship, you have to complete NExT step 1 examination plus traditional practical examinations of the part 2 or the final year MBBS. So here the eligibility for grant of license to practice, you need the internship completion as well as you have to pass next step 2 practical clinical examination. Next step 1 scoring for PG entrance. Now you have to keep in mind that next step 1 examination score will be used as a merit for the PG entrance. With the score of next step 1, you can enter in the postgraduate courses. Total marks for the purpose of determining the merit specially for the admission to broad specialty postgraduate course shall be calculated from the sum of row scores obtained in each paper or the subject. There are 6 papers for the next step 1 examination, and in all these papers, whatever the mark you will get, you have to add on the total. Whatever the total you will get, that will be the score for your PG entrance. In case of failure in one or more subject, for example the students who have failed in next step 1 examination and now they appear for the supplementary examination, then how the next step 1 scoring for the PG entrance for them? In case of failure in one or more subject, total marks percentage of next step 1 for a candidate shall be calculated from the sum of total of row scores in each subjects or paper obtained in both regular and supplementary examination in which the candidate has secured pass marks. That means, for example, if you failed in next step 1 and you appear for the supplementary examination, now in the supplementary examination you have scored the passing marks, then this examination score will be taken as a PG entrance score or the merit score. The someone will give the next step 1 examination for consecutive 3 times to improve their score. The total mark percentage of those candidates who have appeared in next step examination to improve their scores shall be calculated from the average or mean of last 3 consecutive scores. This means if you gave the next step 1 examination for consecutive 3 times, then average of the last 3 consecutive score will be taken as a PG entrance score. For the purpose of determining merit, especially for admission to broad specialty postgraduate course, next step 1 score shall remain valid for 3 years. Now you should remember that your next step 1 score shall remain valid for 3 years. That means for 3 consecutive years you can be eligible for PG entrance on that score. But once your next step 1 score expired, that means it's more than 3 years, then you again have to appear for the next step 1 examination. So that is the reference, and this document has been released on 28 December 2022, just a few days back. So that is the latest guidelines. Alright, if you like this presentation, please share it with your batch, group, friends and colleagues. Thank you so much everyone.